Yay. Thank you for joining us. Thank you. Yeah. We just allow a couple of minutes for more people to join us. Thank you for joining us. Okay. Just a few minutes. Okay. Hello, everyone.
Hello.
Yeah. Hello. Thank you for joining us today. Let's begin. Thank you for joining us. Just 1 minute more, then we'll start the webinar for this session. Thank you. Thank you for joining us for this edition of Aging Lifestyle in Blacks and Asian. That we have the short form to be ALIBSA, which is a monthly webinar where ALIBSA is a kind of a knowledge exchange platform, which we have our founder to be Dr. Fatia Ni Odumusu. And we have a group of admin where we join ourselves together. We bring ourselves together to attend this webinar, which is an educative one every month. So just see if we could have a few more people to join us so that we can begin. Okay. Welcome, everyone. Just for us to begin. Today, I'll be hosting with my colleague here, one of the volunteers, which is Shakiro. She's a graduate of pharmacy from prestigious Oba Olavisi Onobanja University. Sorry for that, because I graduated from Obafemi Awolowo University, so I'm mixing that together. So she's a pharmacist, which is keen on research in public health and global health. Shakira, please say hello to everyone.
Hi, everyone. My name is Shakira. Thank you
Yeah.
for joining.
Okay. My name is Abolanle. I'm a medical doctor and a doctoral researcher at UWI Bristol. So I'm involved in intersection of medicine and health education. So our agenda today, we'll be talking to you using these notes, talking about the introduction to the webinar, which I have introduced you to. It's about a knowledge exchange platform, ALIBSA, where we bring people together to understand more about their health and understand how to have autonomy on managing their own health and understanding the fact that health is wealth. So, and today we'll be introducing our speaker in a bit, and we'll be taking some questions at some point, okay? And today's webinar discussion is talking about tackling stigmas and mental health awareness. So at some point, we would have question and answer and a closing remarks, okay? And the housekeeping rule, I'll leave that to Shakira to talk to us about it.
Okay, hi, everyone. The housekeeping rule is just to ensure that we all enjoy the webinar. So please be on mute, switch on your camera. We would like to see your face, and you can raise your hands to ask any question.
Okay, thank you very much for that. Today we have I have the honor to introduce to you Dr. Herbert Webe. Did I pronounce that well? Sorry.
Yes,
Is
you
that,
did. Yes, you did. Yeah.
oh, thank you. He's an associate professor from University of Roehampton, and he's a of mental health and senior teaching fellow. He's knowledgeable in this, and he is leading a team of nurse academics. He specializes in improving physical health, physical health outcomes in several mental illness, like psychopharmacology and recovery approaches. So he is a specialist clinical advisor to the Care Quality Commission and a panel member of for the Mental Health Review Tribunal, and serves on the editorial board of the British Journal of Mental Health Nursing. He also co-directs the Uganda Nurses and Midwives Association UK. So we have the honor to introduce our speaker today to you. Thank you very much for being part of this webinar today and trying to help us out, Dr. Herbert. So I would leave the floor to you to begin, sir. So I'll
Thank
stop
you.
sharing.
Thank you, Fatia and Bola, for obviously this wonderful opportunity to invite me to come and speak to everyone today. And I hope everyone can hear me clearly, and you can see my very handsome face today. I decided waking up this morning that I'm going to big up myself to give me some positivity, because last week I had an extremely busy week. And sometimes, you know, we go through life and all we can think about are the downers, you know, the bad things happening to us in the week. So obviously the session today is about mental health, mental well-being, and understanding how we can actually tackle the language, the positive language we can use to ensure that we can promote that aspect within ourselves, but also promote that within our communities. So, but I'm going to share my slides in a minute. I hope everybody will be able to see them.
Yes, we're able to see.
Okay, so what I'm going to talk to you guys today about is about mental health and how we can sort of address sort of the stigmas that inhabit or affect our ability as members of a community, respective of what community you belong to address those issues within our environments. And also we will briefly look at some of the things that we have to be aware of, particularly thinking about the language, because the language quite often when we're describing people with a mental health problem or people with a mental health disorder, you know, sometimes that language can affect our ability to engage with those persons, but also their own ability to engage with services, and also having those conversations with their family members. So the language is one thing I'll talk about, but also essentially I'll talk to you guys about how we can identify and be able to sort of support people that within our communities may present or report or exhibit, you know, signs or symptoms of mental ill health. And I suppose across the board, we do, irrespective of which community, whether you're Ugandan or Nigerian or you're Caucasian or you come from the Middle East, you know, there are various challenges that I think we do face, particularly trying to you know, sort of uplift the agenda around mental health well-being and outcomes, you know, and I think often that is informed by our own sort of cultural as well as traditional beliefs about what health is or health is not. So the objectives today really is for me to be able to explain and define what mental health is or mental ill health. We will briefly look at the potential causes of health problems within our communities, and obviously the things I'll discuss briefly, you know, are only a snapshot of the potential causes of mental ill health within our communities, and by no means that will be an exhaustive list. I will also look at sort of some of the core risk groups. What do I mean by core risk groups? So who are the people within our communities that we should be paying attention to? Senses, our hearing, our seeing, that those people are much more likely to present and report and exhibit, symptoms of mental ill health. And obviously, it is that particular population that I think this session is really about for you as a carer or as a friend or as a father or mother, that you need to be able to understand how you can support them. And obviously, I will conclude the session by looking at obviously the how do we identify those issues within our community, but also how do we look after our own mental health. And I'm sure most of you here, you do many various things to promote your own mental health and well-being, to be able to live in a complex, and I dare say it's a complex, ever-changing world we live in, because 2 decades or 3 decades ago, things were quite different than things are at the moment. So I want us to just pause there for a minute and think about, in your own communities, in your own sort of subcultural sort of dimensions. When I say subcultural dimensions, I mean where you particularly live, who you are as a person, what things do you identify with, or what things do people around identify you with, and how you were, which communities were you born in, and to think about some of the things that you remember as a child that people used to use or used to say, particularly when they're describing somebody with a mental health problem. So what words did they use? What words are they currently within your communities? And you may be on here and you're logging in from rural Nigeria, or the urban cities, or you're logging in from London or the outskirts. I am sure that some of these things will probably be you hear them in your communities, how people with mental problems being referred to. That could be within your own homes or within your friends. But also, I want you to pause there and think about, mental illness. What images come to your mind when you think about mental illness or a person with a mental health problem, and where do these images, come from? Obviously, if you're here on your mid-teens or your mid-30s or 40s or 50s, I'm sure over the time you have been exposed to various many sort of entities or replications about what a person with a mental health problem is or is not, and obviously quite often, a lot of these subliminal messages do often come from the media, so from television, from the news, when people with mental problems, either are involved in some form of a crime, the public is going to know. They will know, because not necessarily because of the initial crime or the act of criminality, is often maybe because of their primary diagnosis, mainly because of the fact that they've got a mental illness, and the tabloids sometimes can be quite misleading, because we do know that there are many more people out there who actually commit crime, but they don't have a mental health problem. So I want just to allow you to think about that, and maybe sort of hear from one or two people to understand where in your own community you've had these types of language about people with mental health problems.
Thank you for
Anyone?
that. Someone had said, I would picture someone looking unkept as mental health.
Thank you.
Yeah.
Thank you. And that's a very important observation, and I think the picture of what we have in modern sort of upper class or middle class sort of society is, you want to be presentable, and the notion that if you're unkempt or you have sort of maybe a foul odor, or maybe you're on the tube, it's very likely that for your friends and family, and even for people that may not necessarily know you, they may suspect something is not quite right, but does that necessarily mean that if I am unkempt, I haven't combed my hair, or maybe I am wearing inappropriately during a particular season, that it's very likely that I have a mental disorder or a mental illness, and sometimes these are particular references to people with mental health problems that are that may be actually sort of true across the other population, not just people with mental problems. So any other thing, I'm afraid I'm not able to see the chat, but is there any other thing?
Someone just said
that
in Africa, they mostly call it witchcraft or cost.
Yeah, and those are very important points, and I think particularly for people that come from sort of subcultures where there is a lot of connection between sort of what society perceives the individual to be or to represent, and their background, you know, sort of the genealogy within families, you know, how do you become who you are? For example, I am from Uganda, and I belong to a particular tribe called Baganda, and the connections, you know, for Baganda through the years and the generations. Sometimes, you know, when you unpick my particular clan, you know, in Africa we have so many clans, but when you unpick my particular clan, you know, I have to then deconstruct and understand where my name comes from, and you know what my forefathers did you know, and sometimes there is that belief that when you belong to a particular sort of geographical sort of affiliation, whether that's cultural, you know, that you've carried on representing or manifesting, you know, your ancestors, you know, sort of phenotypes or this characteristics, you know. And for the people that actually don't know you, you know, if you're behaving in a certain way, they say, well, you know, that child or that person, you know, is behaving exactly like, you know, his great grandfather, who was a bit sort of mad or crazy, or you know. So some of those things sometimes may be manifested or may be exhibited in the way we actually approach these topics in our society, mainly because I think we, for one reason, we may not necessarily be able to understand, you know, a lot of the context as opposed to the things that actually are happening to us because of what we've been told by our fathers, or within the cultures where we are raised. So a lot of those are important points, but it's important for us to recognize that mental health is just as important as physical health. I mean, I always think about scenarios where, you know, can you possibly imagine, and there was an outbreak, you know, where, you know, students in primary school, or even maybe year 7 references the first year of secondary school in the UK, where within a week, you know, year 7 students, you know, maybe about 60 of them have broken legs, you know, because of playing out in the field, you know, and this makes news in the newspapers or on the tabloids in the UK. That will be a public health catastrophe, you know, because, you know, the school will come in disrepute. How can year 7, you know, students break legs, you know, within a week? But obviously that will give much more attention because it's a physical health issue, you know. But quite often when we hear students, either for one reason they have got or manifesting psychological issues or problems, you know, sometimes in schools or within sort of our families, you know, sometimes those topics are not given much significance because it is really, you know, and nobody really sort of wants to understand the background from that. So there is this sort of perception that, you know, if you're physically unwell, you go to your doctor, to your primary care doctor, to A&E, you know, you will have much more attention because you have an ulcer, you have a cancer. Not quite the same, you know, if I was to go to A&E, if I was to go to the emergency room to say, well, you know, I think on this occasion, I feel extremely depressed, I feel sad, you know, and that is obviously one of the disparities between the attention that we give to people with a mental health problem and physical health. And this may be the case in other countries, you know, but particularly in the UK, we know that there is a big divide, and so on and so forth. The other, you know, misconceptions about mental health or mental illness that we tend to see across the board is the reality that many members of the public may perceive people with a mental health problem to be, you know, to be violent and aggressive, you know. Whilst there is some truth in that, because having a mental illness, particularly, you know, the more severe forms of mental illnesses, for example, schizophrenia and bipolar, whilst you know, a small proportion of patients that carry these diagnoses, you know, because of their diagnoses, may be more likely, you know, to exhibit, you know, violent tendencies. We do know actually that, you know, the violence exhibited by people with a mental health problem, is actually, much smaller, in fact, significantly smaller to the levels of violence we see across amongst other people without mental health problems. But because there are public images about people with a mental health problem, and the acts or omissions of acts, and the risks they pose to members of the public, the media appears to pause, and exploit the narrative that people with mental problems are obviously much more dangerous than you would be criminal who ends up in prison for robbing or even attacking people on the streets. So, some of these misconceptions about mental health are really affecting and really interfere with the ability for us to actually have meaningful conversations and discussions about, where people are, and also can interfere with the ability to enable people to access and therefore benefit and utilize support as it were. In fact, we do know that people with mental health problems, in fact, they are much more likely to be a danger to themselves. In fact, they may die, they are often, more likely to die by suicide because of the nature and the degree of particular illnesses that they may exhibit during the course of their lifetime. So the other thing related to that I think is important for us to bear in mind is, when we are advising and talking to people about mental health problems and the fact that we want them to be able to come to open up and engage in conversations, talk about their feelings, their emotions, we have to be mindful of the language, and some of these things that you see there in the bullet points there, you see they are sort of unhelpful languages that I think across different communities they have adopted by way of describing people with mental problems, so again, referring to people as mad, they're crazy, they're lunatics. If you live through the 18th century, 17th century in this country, and I think other countries as well, before psychiatry, became more sort of refined, and by that I mean it became sort of more a science, more empirical sort of part of medicine. We would know that people in those communities were often subjugated and relegated away from sort of mainstream societies because they are possessed, they are lunatics, or they acted strange. And, fast forward, 60 years on, we do know that some of this negative language still does exist in our communities. For example, as I said, I'm from Uganda, and I remember growing up in Uganda, people that presented with a mental disorder often, at the time, people didn't really recognize that they actually suffered from mental problems, but they thought were generally possessed, they are bewitched, and they are mad, crazy, like using some of the language that sometimes would, actually stop those particular individuals to be able to actually, want to talk about their fears and their worries. So some of the language that we use to describe or refer to people can really interfere with the ability to seek support. So, I mean, what is mental health? These are questions. This is a question that I think if you sort of scroll a wide variety of literature, you'll probably find that there are maybe 3 or 4 particular definitions that can help us to understand what really is mental health. Now, I'm not going to ask you to sort of feed back to me, but if you think about your own mental health, what image comes to mind? What is it that you want to talk to yourself about your own mental health? And these are things that I personally, as a mental health professional, but also an academic, I go through every single day to think about it from the point of what really is my mental health? Is it that my mental health is the way I am able to, my 5-year-old who sometimes really irritates me to the point that, well, he doesn't listen. How do I manage that transaction between a very impatient 5-year-old and for me, who's a 46-year-old man? Do I scream and shout and show my 5-year-old I am completely unable to manage my emotions in front of my 5-year-old? You could have a different example, but mental health really can be defined really as a state or conditioned state of being where you, the person or the individual, realizes their own potential and can actually, be able to cope with normal stresses of life. But also important with that, if you're able to deal and manage normal stresses of life, are you able to productively, and maybe sort of consequent to that, be able to contribute to your community. And that community basically means your own person, because a community is not a community before you can recognize that you have to be your own community, you as a person, so the things that you say, you do, you behave, how you express your emotions really has an impact on other people around you, and if sometimes people are unable to recognize that, we can tend to see, things spilling out of control. So think about your own mental health, and how you actually manage it, to serve it, to feed it, to ensure that you remain who you are, you remain true to yourself. Now, normal versus illness, these are sometimes some of the debates within the medical world and also within the health domain. So what is it really that we want to understand about what is normal and what is illness in terms of mental ill health? Sometimes we actually struggle with this because there's no exact definition between what is normal and what is an illness. But perhaps one of the ways to think about this is to think about, symptoms, so signs, so the things that you may be able to observe in your loved one, in your child, in your 18-year-old who suddenly has started to withdraw from going to school. They feel like they don't want to go to school, to play with their social sort of networks. They feel like, something is not right. You may want to think about, last week, young man was very vibrant, he was happy, go lucky, going out with his friends. Something has changed. You as a carer, as a parent, you may be able to pick out, so this was the line that your son was reporting or exhibiting as normal. Something has gone wrong, to start to bring about what you and I may call signs and symptoms. And obviously for clinicians, we want to be able to understand what is the background history, at what point something happened for that person to start to behave or to exhibit particular things, or to behave in a certain way, which may indicate that there is a problem. And sometimes symptoms may interfere with the person's ability to cope with a personal relationship. So again, those things that we sometimes take for granted, work, turning up on time at work, being able to sort of plan your day, and also navigate sometimes what it appears to be a complex world we live in, affecting, our active daily living. For example, sleep, diet, when there is a pattern where our the activities that we tend to engage with, we enjoy, if there is a pattern where our being is affecting those activities, there may be sometimes a recognition that yes, this particular individual, this person may require a conversation with maybe their parents or with their primary care physician to think about how they can get them back to the state of normal functioning. And obviously a lot of these stresses are environmental. They come from within our environment, and really is about our ability to manage and negotiate some of these stresses. So beyond this threshold, we do tend to see mental ill health or mental illness emerging. And sometimes obviously this is a general term that we tend to use to describe a range of mental group of illnesses or disorders of the mind, which really affect a person's thinking. So the way you think, for example, me being an academic, sometimes I step into a classroom and I'm the only Black person there and everybody is white, so having that sort of imposter syndrome sometimes, even though I've been in academia for many years, many years later, I still have that imposter syndrome. Either do I look at the exit doors and I run away because, all these eyes, white people's eyes are on me, and is there some form of sort of prejudice towards me as a Black academic? There may be the case, but how I manage that situation there and then is going to determine how I manage my own well-being and my own mental health going forward. So how do we think about things? How do we respond to situations? And obviously what we think sometimes often has a direct impact on our feelings, our behaviors. In fact, I always say to my students, that psychiatry, compared to other areas of medicine, is possibly the most, sometimes I think I would probably say a lot more straightforward, because we think about how we think, how the thought pattern can affect our feelings, but also if I feel that, maybe a bunch of my students, regard me as not incompetent, I'm going to stop going into the lecture room. And that's a behavior aspect. So if I was to then stop completely to go to do my job, that is going to affect how I feel. I'm going to feel, possibly get panic attacks. I'm going to worry that every white person is against me. So there are three dimensions when we think about mental ill health. So our thinking, our feelings, and our behaviors often is what, for us as healthcare professionals, we want to assess when we see patients or when we see people in clinical practice. So, but what is mental illness? The fundamental question for what is and what is not mental illness, as I said, sometimes can be complicated and contentious. And this is actually, the case across many of the services, because we do know that people's beliefs about what is health or what is not health does vary based on our own health beliefs, our cultural beliefs, our spiritual beliefs. For example, I am a born-again Christian, and I do believe that God does actually appear to me when I pray, and there's been instances when I visually have seen God and he's talking to me about my own life, but I have got to be more careful, because as a healthcare professional, if a patient is under my practice and I try to impose my beliefs on that person, if they don't believe, that is going to create more problems for the patient. So there were perceptions that are sometimes influenced by our own traditional, cultural, sort of spiritual beliefs, that for some people it may be that, well, that actually may connotate or may exhibit what in their view they've constructed as mental ill health, where in a different context, a different environment, it is completely acceptable for you to, close your eyes and hear voices from your great grandparents, and all of that. But in a different context, those things may not be necessarily accepted. But unfortunately, the medical model, particularly the psychiatric medical model, does not appear to give allowance for transcultural understanding of disease, illness, particularly when it comes to psychiatry. I mean, there's now much more understanding in terms of training, and I'm not sure about other countries, particularly in these countries, much more understanding that people may present, for example, with depression, anxiety, or schizophrenia, and that it is not a one-size-fits-all, that people may present with these illnesses, and it may be different for each and every individual, again, based on their cultural, traditional beliefs. But mental illness, as I said, really can affect our emotions, and obviously, the problem nowadays is that we overly try to medicalize each and every negative feeling or emotions that we tend to have. For example, it's very normal to feel anxious, when you just, I don't know, you're going to do an interview, you've never done an interview before, or you're going on a date for the first time, you're not entirely sure what to say in your first date. It is perfectly normal for you to feel apprehensive, and sometimes a bit, you're not unsure, you're not very unsure. That is actually quite normal and part of normal development. But what we don't want to do is to overly go down the route of overly medicalizing every symptom, every feeling that we get, to say, well, that is specifically because that person may be at risk of developing a mental health problem. We don't want to do that, because if we do that, then we are going to diagnose or find each and every member of the public. For example, there's 64 million people in the UK. I am sure most of us at some point, particularly if you're here and you like Arsenal, or you play football, you've lost a game, you may feel a bit under the weather for a couple of days because your big team has lost the game, but I'm not going to go and diagnose anxiety for each and every person who supports Arsenal. And for example, Liverpool recently won, I think, the Premier League, and people exhilarated. They're very happy. That is normal. So mental health, particularly, is about our emotional well-being and how we navigate and sometimes a complex world. It's about how we feel and conduct relations, but also navigate, those sometimes difficult situations in our lives. Positive mental health also is intertwined in all of this. How do we maintain our own well-being to be able to remain resilient and to address some of these issues I have talked about?
Yeah, thank you.
Are there any questions in the chat?
Yeah,
in the chat?
we've had
Sorry.
some comments there trying to express themselves, and it's a good one. I'll read that out to you at some point. We're just trying to see if we could round up a little bit faster, because we have less than about 20 minutes just for us, so that we can bring the questions in.
Okay, all right. Okay. Now, I just want to then move on just quickly. I'm not going to go through each and every point here, but just to alert you to some of the causes or some of the factors in life that may reflect the nature of mental illness. And some of those things we often reference. For example, mental illness, like other illnesses, may often sometimes exhibit or run in our families because of the genes that we are born with. Complex grief, we've lived through sort of COVID-19, where there was a lot of uptake of people sort of dealing with grief and loss, significant life events, losing a job, sort of divorce, and also long-term problems. A lot of these may reflect the course of mental illness, and I think many of them over the course of an individual lifetime may interact to bring about some of the symptoms I will talk about. Again, a common thing, particularly in the West, and I think to a degree in low middle income countries, is the effects from alcohol abuse and substance misuse. We do know that these substances can influence and affect our ability to either think clearly, emotional regulation, and so on and so forth. So there are a wide variety of factors within our environment that actually not only can increase the risk of mental health problems, but also physical medical problems, as it were. Now, obviously, the reality is that mental health issues or mental problems are on the rise, particularly obviously within the West. We do know, if you work within clinical services, that is an emerging problem. As I said, there are effects from COVID, but also other countries, I'm sure, probably have the same case studies. But this is mostly sometimes also fueled by stigma to mental ill health. Particularly people with mental health problems suffer and face within their communities, and that it is always important for us to be aware of how we can support them, and being aware that that the support that goes towards people who may come to us exhibiting symptoms of mental ill health really has to come from a loving sort of disposition as carers, as family members, to try to understand where they are, and also to use our understanding of their situation to not beat them down with a wooden stick, but to help them, to re-guide them to where they ought to be going. So a mental health crisis is really, the acute phase or the acute presentation that sometimes we do tend to see in people that may present in our communities with a mental health problem. And the crisis is actually the word in itself points to a red alert, traffic light system, red, amber, yellow, green. You're thinking about somebody with a red alert, and you may need to do something quite urgently and possibly soon as possible to ensure that they actually get urgently the help that they require. But also being aware that, in that situation, that you possibly may be the only person that may be able to support them, and maybe also able to sort of guide them to appropriate services. So some of the possible warning signs that I think I want you to be aware of when in your community working with people that may exhibit mental ill health, particularly if somebody is in a crisis. Again, thinking about the emotions, the thinking, and the behaviors, some of these things are divided against those three dimensions. So they may feel anxious, agitated, feeling angry, and there is a pattern. Is it daily occurring? Is it weekly? Is it monthly? Is there a change? So some of these symptoms may be occurring on a daily basis, every minute, and from you, the carer, the mother, or the care of the young person, you see there is a pattern. There's a pattern forming. Are they becoming too tearful? Is there a lack of energy? And particularly where often, when we're talking about mood disorders, people may report just feeling that, they're overwhelmed with life, and that they don't feel that life is worth living anymore. So you really want to explore by understanding, where this is coming from, and whether they actually have an active plan to do anything about it. And this is about suicidal ideation and acts. So you really want to be able to sort of support them and ask, don't be scared to interrogate, to ask them, if they do specifically have a plan to harm themselves. You're going to want to understand what the problem is and whether they have any of these issues. So some of the risk factors, I think, are quite similar to some of the things I've talked about. People losing loved ones, continued, extended bereavement, people with a past history of mental health problems, as well as suicidal ideas and attempts, are much more likely, to represent with similar issues. Relationship problems, family problems, housing issues. If you think about, the current, issues at the moment, particularly within the UK, there are proposals, although these proposals are not coming in until the next year or 2 years, about changes in the welfare system, disability, and all of that. Some of these environmental factors may induce undue stress on would-be, people from lower socioeconomic backgrounds, financial worries, job-related stress. All of these are telltale signs that we may be able to pick up from our communities, that there are maybe issues that people are struggling with, to be able to support and listen. So, but what can we do in general, really? We want to be able to actively listen. And it's not so much about, yes, well, how about, yes, I have got this issue. Well, I have listened. Well, give me a call tomorrow. No, take your time to really try to understand where the person is coming from, and sometimes it really does help, to reassure and validate the person's feeling and the way they want you to address the issues that they have brought to the table. So what do I mean by that? Hi, Herbert, I'm actually feeling extremely depressed today. I feel sad today. Yes, I completely understand how you feel, and I understand where this could be, how this could be, but I want to let you know that I am here to support you. I'm here to listen, to understand, and you and I, we can work together, to ensure that you get the support that you require. So you're bringing the person who has come to you with need and support, that yes, you're there. It's a partnership. It's a partnership for you to be able to work together. Demonstrating empathy. Sometimes we tend to ignore this. How do we demonstrate empathy? By even touching out, reaching out, touch them if you have to, with their permission, obviously, or guide them towards services. Promoting safety is sometimes a difficult thing. How do you promote safety for people that come to you expressing particular need? By reassuring them and guiding them, and actually offering that you can attend a service with them. If it means for you to go to A&E, to the emergency room with them, then do that. Offer that space and time to know that the person is able to respond to that. Particularly check for any suicidal attempts. If they've had any previous suicidal attempts, ideas, again, engage with that and offer them reassurance that there is support. And red alert, if the person really is eminently reporting to you that they have a plan, a concrete plan to end their life, you're going to want to obviously seek emergency services to come at the behest of that person to be able to offer that support. And as I said, you may want also to have a conversation with the loved ones to see that you can support them as you go forward. So really, if the person has a concrete plan, ensure that you don't walk away from them, but go along with them to support them, to ensure that their safety is paramount. Now, ALGI here is an acronym that we often use to ensure that we have the structured support in our heads, to be able to have that conversation with the person who has come to us for support. Now, if you're thinking about a person who's supposedly who is, at risk of having a heart attack, there is the CPR approach. So you have to be able to sort of ensure that the heart attack, that they get the right support in that context. And sometimes, for mental health itself as well, sometimes having a structure in mind can sometimes help you to understand how you can deliver that support to the individual. And ALGI is an acronym that actually can be helpful in terms of thinking about the support that you want to use to deliver that support to the person at risk of suicide. Again, listening to them non-judgmentally, giving support services where this is coming from, but also encouraging appropriate professional help. And this may be about reminding them where the professional services are, or guiding them where the services are, whether primary care, whether it is a physician within their own communities, but also encouraging other forms of support, is important. It could be about talking things out with their loved ones, carers, and if it is that the medication that they're taking, has run out, you may want to offer that support and guide them appropriately. So ALGI is a short form that we tend to use, very similar to, sort of the APC sort of plan we tend to use when we suspect somebody's having a heart attack. So we want to look at their airways, their breathing and circulation. But so the same analogy applies to when we're thinking about emergency psychiatric situations. Now, I just want to conclude with, obviously, sort of some of the things I've talked about, but particularly focusing on how we can help ourselves to better our own mental health and well-being. Connecting with people, physically activity is actually important, actually within research that has been documented to help to boost our mental well-being, learning new skills, giving back to others. For example, many of the things I do outside my academic role is to speak to people within communities within the UK and outside the UK about my own sort of clinical expertise within mental health. That boosts my mental health. I don't know what you do, but find something that you're good at, something that you want to give back to the community to help you think about how you can support yourself. Even simple things like, rather than sending emails, walk, arrange a personal meeting with somebody, physical, have a cup of tea with that person, arrange a day out with people that you don't necessarily engage with. And sometimes, obviously, we spend too much time on social media, WhatsApp groups and Teams and all of that, and we become, sort of immune to actually the benefits of physical face-to-face interactions. So take yourself outside the digital age and engage beyond your community to be able to sort of boost not only your own being, but also others. I know we are short of time. I want to end it there, and I'm happy to entertain any questions. If there are any questions, Abulani.
Yeah, thank you very much, sir. Thank you for this wonderful presentation. I've been able to learn so much from this presentation today. So, and I believe people have been able to learn as well. Shakira, are you there? So that you can read one of the questions out. Are you there, Shakira? Okay, I'll just take that. We have a question here where someone said, there are so many people who use mental health when they are in trouble, get themselves out of trouble. How can you know the difference? Yeah.
Sorry, I didn't quite understand the question. So there's so many people that use mental health services to get themselves out of trouble.
Yes, like they use mental health, their condition to like say they have the issues to get out of trouble. Probably they present like a person who is having mental health issues.
All right. Okay.
Just
I get what you mean. I mean, that's a very important question, and I think with psychiatry as opposed to sort of physical general medicine, if I break a bone, you're going to see that bone on the CT scan or the MRI. That is evidence.
Yeah.
And I think the challenges with psychiatry, I could possibly finish this webinar today and I tell my wife tomorrow that I'm hearing voices. She has to believe me. So there are sadly many instances where people malinger symptoms of mental ill health, but I suppose it's really for us not to judge whether they are telling the truth or not, because if they are not telling the truth, again, availing them with the support services is important, because at some point, if they do suffer with the mental ill health, at least they know where the services are. But also, if they are telling, they're telling the truth, it could be providing an opportunity for you to actually engage them, to engage with services. So I have also engaged and interacted with people like that in the past, but I suppose it's for us not to, again, restrict ourselves to being judgmental towards those people, but to be loving, to understand why would they, exhibit or present the way they presented, and try to support them accordingly. I suppose.
All right.
Yes.
Thank you for that. Please, you can send your questions in, and whilst we're doing that, we have this feedback form that you could just scan your screen, just give us feedback on what you've listened to today, how you feel about the webinar and everything that we've been doing as ALIBSA. So it's so good that we have you all today. Thank you very much. And then we still have some of the we have a couple of time that we can entertain your questions, and since we have someone here to help us out, it would be good for you to send your questions in. But in case you're not able to send them in at the moment, we still have the opportunity to do that after the program by posting them to our community group. That would be good as well. So I'll just look into the chat box. We have some of the comments there whilst you were giving the talk, which was from Ellen, which says society mostly focuses on just society mostly focuses on the overt signs of mental illness and forgets the most mental health issues are unseen. So those are the things that people had been saying in the comment section. And then we have someone raising their hand. So yeah, you want to
I saw a question that came in about the link between mental ill health and neurological disorders. There is a lot of evidence and research pointing to the link between the risk of developing mental ill health, so things like depression and anxiety, and I think the higher forms of mental illnesses, for example, schizophrenia, and neurological disorders, obviously degenerative diseases, things like Parkinson's disease. We do know that people that exhibit or suffer chronically with neurological disorders do have a high risk of developing mental illnesses. So the answer is yes. Whoever asked that question, the answer is yes, and that same applies to people with long-term physical medical problems as well.
Okay, thank you for that. I think we have some of the questions here. Is there anyone? Kirin, are you there? Sorry. Just for someone to help me to see if there is any missed question. If I've missed any question in the chat box. Is someone trying to talk to us?
Yeah, I've checked, but I can't seem to see any.
Okay.
Please, we can also give people the opportunity to use their mic if they have any questions.
Yeah. If they have questions, they can unmute and ask any questions.
Yes, please. If you do. And it's to be good to give feedback.
I can pose the questions to people who are still on the platform. I mean, how individually you don't really have to disclose, but how individually are people managing to manage their own mental health, particularly in the aftermath of COVID-19, and there are still remnants of that, and the prevailing socio-economic challenges, not just dominant to the UK, but also in other countries, Nigeria, Uganda. So how are people managing to stay afloat per se?
So, like, you would want people to say something about that as well? Would you?
Yeah.
Yeah.
I mean, yeah.
It's be good. Yeah. Would someone want to talk about that? That would be good. And whilst we're doing that, could you please, if you could just switch on your camera, just for us to have a screenshot of this moment together, this wonderful educative moment together. Please, if you could do that, that would be nice. Thank you very much.
Okay, I'll go first. I think I've really talked about my own, but I'll go first. One of the things that helps me really to enact and boost my mental well-being and some of you are probably going to laugh at me, is actually I love chocolate.
Oh.
You know, I love Cadbury chocolate, and I'm not addicted to it. I don't binge on it, but I tend to have maybe a Cadbury chocolate every few times a week, you know, and for some reason, you know, the ingredients in chocolate just help to make you feel better for some reason. There is some obviously background literature to that, which I'm not going to go to, but also things like you know, I before my academic life, I enjoyed music. You know, I play guitar. I used to sing in a band, and there are skills I have carried on. You know, away from the lecture room and, you know, doing research. You know, I strum my guitar, and that actually helps me to forget the worries and the, you know, trials of life really sometimes. But it's really striking that balance in life for us to maintain the mundane chores of daily living, but also forgetting that and say, well, you know what, I'm good. I'm actually excellent. I'm good at A, B, C, D. How can I balance, you know, this and that? But it could be something else for you on this platform today. And I think what I'm trying to say is for you not to forget your own individuality, because if you're a doctor or a nurse or an engineer, that doesn't really define who you are. What defines who you are is knowing who you are as a person. Every time you wake up in the morning, you know, you must say to yourself, you know what, I am fantastic. I am wonderful, you know. And over the past couple of years, I personally have been trying to sort of explore more myself. What is it that I represent in my own life, but also in the life of the people that I am placed on this earth to impact, my students, you know, my wife, children, my family, and all of that, you know. So by understanding who you are or who we are, you know, is a stepping stone of actually recognizing, you know, that if hardships come our way, you know, we can say, well, it's a hardship, but I know my worth, you know. But I'll stop it there because I overtalk.
Hello.
But I know people are aging to give me some feedback, and I know Fred is there. Fred, do you want to say something, Fred?
Hello.
I think Fred is muted. I think he wants to say something.
Would you like to say something, sir? Yeah, you. Okay, now we can hear you.
Can you hear me now?
Yes, we can hear you now.
Oh, yeah. The organization and the professor for such a good presentation. I'm just wondering, because this is not the first one I've attended from your group and from the professor. I'm a bit discouraged with the attendance of our communities. How can we make them see that this is useful? I know that on our own platforms in my community, this has been, but I'm disappointed with our turnout. How can we improve turnout? What have
I suppose I mean
what have been your experiences with other communities? Go on. Sorry.
I mean, there are many ways, I think, for us to empower people to understand that knowledge is power. And I think one of those things for me that concerns me a great deal over the years is that, and I'm not beating down our communities. When I say our communities, if you're here and you come from an African background, an Asian background, you know, I think there is always opportunities for us to learn from each other, you know. But the problem, I think, over the years, particularly I think in the West, there is a lot of, you know, sort of running after, you know, the income, the money. And I think a lot of communities are so much, you know, absorbed with, you know, we need to get by, but how do we get by working as much as possible? And some benefit from this session sometimes becomes secondary, you know. So again, continuing conversations, Fred, in our own communities, you know, attending these sessions and taking away what you've learned, you know, within our own communities, you know, whether it's a workplace setting, you know, I think that will help to drive and disseminate the information that I think people will then be encouraged, you know, to sort of make that behavior change. I think. I know Bola is.
Thank you very much, sir. We have limited time. I'm sorry. I would just like to tell us that our next webinar would be. We have a date on that, which I just want to check now. And then I have the flyer here. If you could see We have Dr. Kende Adeniro, who will be coming on next our live webinar for the next month. So please find time to join us. It would be good to have you all with us. Okay, thank you very much. And we've taken the question and answer for this webinar for today. We thank you very much. And the admin team for ALIBSA, we all have ourselves here, and it's good to have you wonderful people to join us today. And we have our volunteers as well. Thank you very much for joining us this week. We have our champions who represent ALIBSA wherever they are. So it's good to have you all, and do well to join the community. And we thank our speaker for today. We really appreciate, and I've learned so much. I would try to do more things to be active and to be happy within myself. And finding oneself is one thing you've talked about today as well. I've fixed that. So we have these members at the moment, and it will be good for you to help us to join the ALIBSA community, where we stand together to strive and to help in understanding what our health is all about. So thank you very much. Thank you, everyone.
Thank you. Bye.
Thank you.
Thank you. Thanks, Habas.
Bye-bye. Thank you, guys. Have a lovely day. Bye.
Yeah. Thank
Bye.
you. Thank you.
That was a great one. We stop recording. Let me stop recording. Yeah, stop recording.
Okay.